So we can start today's session. Today I'll be taking journal physiology, right? And the very basic thing is the cell organelles and their function. So one important structure is agranular endoplasmic reticulum, which is also known as the smooth endoplasmic reticulum. And here the main function is the synthesis of lipids. It can be steroid hormones, membrane phospholipids, and cholesterol. So anything related to lipids is synthesized in smooth or agranular endoplasmic reticulum. And this is also the site of fatty acid elongation or drug detoxification. Now, why we call them smooth? Because they lack ribosomes, right? So they lack ribosomes, and the endoplasmic reticulum, which have ribosomes, and this ribosomes actually offer them roughness, so they are known as rough endoplasmic reticulum or the granular endoplasmic reticulum, right? So this is also known as the granular endoplasmic reticulum. Clear? So the function of the ribosomes is to synthesize protein. So the function of rough endoplasmic reticulum is synthesis of proteins. It can be secretory proteins or cell membrane proteins. Apart from these proteins, it is also the site of production of lysosomal enzymes. Then it is a site of co-translational modification. Now the word translation actually means synthesis of protein. So co-translational modifications of protein, like hydroxylation of protein and lysine, which is seen during collagen synthesis, right? So it also results in modification of protein structure, and there is initial folding of polypeptide chain proteins into the three-dimensional structure. So anything related to protein, it is tackled in rough endoplasmic reticulum, and this roughness is because of the ribosomes. So smooth for lipids and rough for proteins. So just simple statement. Then microtubules, they are concerned with cell shape. And there is one syndrome, that is Chidiac-Higashi syndrome. This is because of tubular polymerization defect, and this results in impaired phagocytosis. Now phagocytosis is a mode of defense where the phagocytic cells, they actually engulf the bacteria, right? So that phagocytosis is a method of defense by WBCs. Okay. Then there are certain medications which act by affecting the microtubules, like mebendazole. This is anti-parasitic. Then colchicine, and again thiabendazole, which is also anti-parasitic. So these drugs, they act on microtubules. So macrotubule, it offers cell shape. Clear? So microtubules related to cell shape. Then another structure is peroxisomes, and if you remember hydrogen peroxide, so These peroxisomes are related to catabolism of hydrogen peroxide, and they contain oxidase enzyme. So peroxisomes, peroxides. So you can remember something like this, similar sounding terms actually. Then mitochondria, these are known as the powerhouse of cells. And why we call them powerhouse? Because these are the site of production of the energy compounds, that is ATP. So mitochondria is the site of ATP production. In terms of biochemistry, they are the site of Krebs cycle, right, which is also known as the TCA cycle. Then beta oxidation of fatty acids, then oxidative phosphorylation and acetyl CoA production. So these are all actually biochemical reactions which are occurring here. So these are biochemical reactions. And in relation to this Krebs cycle, we usually discuss one point that since it is occurring in mitochondria, so it does not occur in RBC, because RBC, they lack mitochondria, right? So anyway, so the main thing is which you should know is that they are the site of ATP production in terms of physiology. And if you can remember few biochemical reactions which are occurring here in mitochondria, then nothing better than that. Clear? Now the mitochondrial DNA is double stranded and it is a circular molecule, right? So double stranded circular molecule, and the word inheritance is strictly maternal. Now it means the mitochondrial DNA will go from mother to all children's. So whatever the number of offsprings are there, if mother is having any disease, if it is transmitted through maternal mitochondria, it will go to all offsprings, right? So whatever the number of children are there, they all will get the disease, as compared to father, who will not pass on the disease to any of the child. So this is purely through maternal route, and it will affect all the children's. So this is very important. So if in pedigree, if you see mother is affected, and if all the children's are affected, like usually we draw pedigree of a mitochondrial inheritance like this. So say this is affected lady and it will marry a normal male. So the children's whatsoever are coming from this couple, now this is male, this is affected female having some disease. Clear? So whatever the children's will come, all will have the disease. So this is affected daughter, this is affected son, okay, so this is one more affected son. Clear? So this is how the maternal infection is, the maternal inheritance is drawn in terms of the pedigree. So from affected mother to all the child, but father has nothing to do here. Then Golgi complex, this is for post translational modification of proteins. Now post means after, and we know that translation is the process. So translation means protein synthesis, right? So this is protein synthesis, and this occurs from RNA. So the modification, it occurs in Golgi complex. It can be sulfation or phosphorylation, and the modification can be in terms of sorting or packaging of secretory proteins like insulin are packed in clathrin coated vesicles. So it is all about post translational modification of proteins, right? So these are some important cellular organelles for which you should know the function. Smooth, remember, for lipids. Rough, remember, for proteins. Clear? So even if you just remember one term, that's sufficient. Then microtubules, cell shape, peroxisomes, catabolism of hydrogen peroxide, mitochondria, ATP production, and Golgi complex, post translational modification of proteins. So these are few things about some important cellular organelles. Now we move to body fluids, and here if a person is of 100 kilogram, 60% of this is body water. So 60 kilogram is water in the body, right? So 60% is the weight of a person is because of water in the body. That's one thing. Now out of these 60%, 40% is intracellular. Okay, so this is intracellular. And when I write the word intra, it means inside the cells. Obviously, the remaining 20 kilogram will be the extracellular. Okay, so this is extracellular. Again, if I using the word extra, it means outside. So this is present outside the cells, not within the cell. Now out of this 20 kilogram, there is further division between the interstitial and the plasma. Clear? So this is 5 kilogram and this is the 15 kilogram, right? So this is how the body fluids are divided. 60% of total body weight, 40% of total body weight, 20% of total body weight, out of which 15% of total body weight and 5% of total body weight. Clear? So this is how it is calculated. Now moving forward, so this we have already discussed. Total is 60%, out of which ICF is 40 and ECF is 20. Right? Now we said that 60% is body water. 60% of the body weight is actually water. Now what about the remaining 40%? So the remaining 40% of the body weight is because of some organic or inorganic material like proteins, fats and minerals. So these all structures, they make up the remaining 40%, out of which 18% is, so if we take 40 here, so 60% is body water and the remaining 40 kg is shared between the proteins, fats and minerals. The proteins are, if we write 18, right? So this is 18 kg, this is 15 kg and this is 7 kg. Clear? So this is how in a 100 kilogram person, this is how the distribution of the weight is in terms of intracellular, extracellular, and the organic or inorganic material, which can be fat, proteins, and minerals, right? So this is how the body weight is divided. Now when we say extracellular, extra means outside, of course. So extracellular is the one which is outside the territory of a cell. So if you look here, this is a cell. Inside you can see a nucleus, and this is all fluid within the cell. Okay, so this is all fluid within the cell, and this fluid is known as intracellular fluid, and this is about 40% of total body weight. Now the fluid which is outside the cells will be all extracellular fluid, right? So this is outside the territory of the cells, and this is the extracellular fluid, which is around 40%, which is around 20% of body weight. Clear? So this is 20%. Now here the 5% weight is in plasma. So this is 5%, which is within the vascular column. So this is 5%, and the remaining, which is outside the vessels but not within the cells. So this one is all interstitial. Clear? So this one is all interstitial, and this contributes to about 15% of the body weight, right? So this is how the weight distribution is done in terms of body fluids. Clear? So interstitial is only 15%, and interstitial is actually in between cells, you can say, and plasma means within vessels. Clear? So this is how it is, the division has been done. Now in extracellular fluid, the major ions are sodium, chloride, and bicarbonate. So these are predominant in extracellular fluid, but in intracellular fluid, the predominant cation is potassium, right? So ECF is rich in sodium, and ICF, that is intracellular fluid, is rich in potassium. Now in inner ear there are two types of fluid, endolymph and perilymph. So the endolymph is also rich in potassium, and therefore endolymph is somewhat similar to ICF. Similarly, the perilymph is rich in sodium, and it is somewhat similar to ECF, right? So these are the inner ear fluids. So these are actually inner ear fluids. Clear? Now there is one term, anion gap. When we in the body, when we subtract the number of anions from the total amount of cations, the value is not zero, right? So it means the measurable cations are more as compared to the anions, and therefore when we will take the difference, we will get some value, and this is known as the normal anion gap, that is 10 to 12 millimoles per liter. So it means both the things are not equally measured, right? Then total body water, it can be measured by tritiated water or D2O, that is deuterium oxide. This is for total body water. For extracellular fluid volume, we can use inulin, mannitol, or thiocyanates. And for plasma volume, which is present within the vascular channels, we can use Evans blue RBC labeled with phosphorus 32 or chromium 51. So these are actually radioactive isotopes. So anyway, this is all theoretical. You have to just mug it up. Now, many times we use one term, oncotic pressure, and this is actually the pressure which is exerted by the plasma proteins. In simpler terms, you can write plasma proteins, right? And the effect of this is that, suppose if this is a vessel, there are plasma proteins within it, and these plasma protein, okay, so these are plasma protein, and they have this effect of holding the water in vessel, right? So they will hold the water within the blood vessel. Clear? That is very important. And this is known as the colloid oncotic pressure. And therefore we see when there is loss of proteins from body, usually through urine, when we call it proteinuria, this results in albuminemia, and then there is reduction in oncotic pressure, and hence the fluid moves out of the vascular compartment. So the fluid will move out. Clear? So fluid will move out of the vascular compartment. So fluid moves out of vessels into the surrounding area, and this is clinically noted down as edema, right? So this is, in terms of pathology, it is known as transudative edema. Fine. So this is, anyway, we will take later in pathology, but for the time being, what I want to show you that these proteins, they have this water holding capacity, and if the proteins levels are less, then obviously the water cannot be held back in the vascular column, and it will move out through the vessel's wall, right? So it will cross the vessel's wall and it will move out into the interstitial space. So this is one thing. Then there is one term, Newtonian fluid, that relates to fluid whose velocity remains constant, and the example is water. And therefore, if I ask you non-Newtonian fluid, you can answer it as blood, right? So this much in terms of body fluids. Then there are three major class of the molecules in the body. One are the structural fibrous proteins. So structural fibrous proteins, and the most common protein in the body is collagen, elastin and fibrillin, right? So out of all these three, collagen is the most dominant form. So these are structural fibrous proteins. Then there are some adhesive glycoproteins like fibronectin or laminin, right? So these are adhesive glycoproteins. Then there are glycans, which includes hyaluronic acid, chondroitin sulfate, heparan sulfate, right? So all these are glycans. Now this table is about the location of collagens in the body. And here, if we write the types and location, so there are few which you should remember, like type 1, it is mainly present in the bones. Clear? And of course, this is the most common type in body. So it is mainly present in bone, tendon, and skin. Type 2, this is in cartilage. Clear? Then type 3 in blood vessels, right? Then type 4 is in basement membranes, especially in glomerulus. Okay, so type 5, you can say it for placenta. Clear? So out of all these, type 1 is very important, and type 2 and type 4. So 1, 2, 4 are extremely important, and a student should know that. Then moving to some cytoskeletal elements. Now the word cyto means cells. So cytoskeletal elements, it includes microtubule. We already discussed that it is responsible for cell shape. It includes cilia, flagella, mitotic spindles. Now flagella are the structure for motility. Okay, so it is for motility. Clear? So cilia, flagella, mitotic spindles. Then there are two muscles proteins, namely actin and myosin. Now these are responsible for contraction or and relaxation of muscles. So we will discuss them later in muscle physiology. So for the time being, just hear the terms actin and myosin. Actin is known as light filament, and this is known as dark filament. So if you look in the image, now the functional unit of a muscle is sarcomere. Clear? So sarcomere is the functional basic unit of skeletal muscle. Remaining details I'll take later. Then moving to cell transport, how the things are transported along the cell membranes. Now here there are two terms. One is basic terminology, diffusion. And diffusion, it means, like suppose if this is a membrane, some substance will be on one side and another group of substance will be on the other side, right? So the rule says that there will be a free flow from the zone of high concentration towards the low concentration. Clear? So from high towards low. So this is the direction, and this is a passive method. It does not need any energy at all. So this is known as passive diffusion. It is not an active process, does not require energy. It is a passive process. So this is a transport of a substance along the gradient, right? Energy is not required. Along the gradient means from high towards low. So this is the gradient, high to low. So it can be of two type: simple passive and facilitated diffusion. So simple passive is the one which is shown here in the image. There is no requirement of any helping molecule, that is the carrier. So here nothing is required. But sometimes if the process of passive diffusion occurs by the involvement of a helping molecule, that is a carrier, then we will call it facilitated diffusion. So facilitated means which facilitates, or which helps, or which promotes, like that. So here there is an carrier molecule which is bringing about this passive diffusion. So simple passive diffusion and facilitated passive diffusion. Now passive, high to low. Now if you take, again you take the membrane, this is low concentration, and here this is high concentration. Clear? So this is high concentration, this is low concentration. Now if the transport is occurring from low to high, it is only possible if there is some energy used to transport the substance along opposite to the gradient. Right? So ATP is needed if you want to transport a substance opposite to the gradient, means low to high. So this is known as active transport. So this is known as active transport, and active means ATP is needed. It cannot work without ATP. So there is transport against a gradient, and when I say against, it means from low to high, and energy is needed, of course, here. That is by the involvement of the ATP molecules, and it can require a transport protein which facilitates this process, right? So this is primary active transport. Now the another term is secondary active transport. Again the concept is same. Active means from low to high, and energy for transport is derived from a sodium gradient, right? So here this is very important. So there is a sodium gradient, and of course the protein is needed for transport, and the keyword is against gradient, right? So this is secondary active transport, and here you need a carrier to do the transport part. Of course it is needing energy and a carrier protein, right? So these are few types of cell transport. Passive diffusion, which can be simple passive or facilitated. Similarly, active can be primary active, or it can be secondary active, right? So I think this much is enough for general physiology, and I think we have a lot of facts to discuss in when we'll go in a region wise physiology, right? So enough for the day. Thanks for coming online and giving your valuable share of time. So see you next week. Till then, good night, take care, bye bye.